implant impression. Now we finish the closed tray technique and start with the second method, which is the open tray, or we call it the direct. Here the impression cupping, making impression tray modified to allow screws that extend 2 to 3 millimeters above the tray. Impression posts are locked into the impression. The main advantages of open tray impression technique are: first, less chance for error. Impression posts are not removed from the impression until the model is fabricated. Second, the implants can be divergent from each other and or adjacent teeth, so we can use the implants that have more divergent than 15 degree, and the implants are deeper. While the disadvantages of open tray impression technique are the patient must have adequate vertical opening for the tall impression screws. Very necessity to use open impression tray or make it so we cannot use the conventional stock tray that we have. Once the impression material is set, it is difficult to quickly remove the tray. So if the patient have a gag reflex, he must not use this method. Impression cupping time is more important. We choose the hand driver, the system, and also the driver. Then remove the healing abutment by the hex and check for tissue invagination, also like we do with the closed tray technique. See the tissue around the fixture. If there is any abnormal growth of the tissue or discomfort, treat it before taking the impression. If not, and the healing is good, so we go to select the impression post. Select the proper impression post and also we seat the impression post inside the implant and then take the X-ray to be sure that it is fully seated inside the implant. Take the X-ray, and also, as we said in the closed tray technique, this is a mandatory when seating of impression post that cannot be visually confirmed, and position the X-ray tube to be perpendicular to the interface of the implant post and implant. We can see here the X-ray and see that the impression post is completely seating, while in the second X-ray the impression post not completely seating and there is a space between the impression post and the implant. Then we prepare the tray that have an enough opening for the impression post and not interfere with them. Close the opening or holes in the tray posteriorly and take the impression by using the syringe type material of the elastic impression material, putting on the material around the impression post, and then adapted the tray, and we can see the impression after removal from the patient mouth, after unscrew the impression post, retaining screw and remove the impression tray, and then evaluate the impression for accuracy. So we must unscrew the impression post before removing of the impression. After that, replace each healing abutment into the appropriate implant site and tighten it by using the screwdriver, or sometime need the torque ratchet. All the impression component along with appropriate models, byte registration, and shed selection will be sent to the laboratory to complete the construction of the prosthesis. We can see here some of laboratory specification that must be used in technique for continue the restoration. First, use of soft gum. This is a material that is soft in its texture and put around the analog inside the impression before we start pouring of the impression. And after pouring the stone, the shape will be as that in this picture. Here also we can see the soft gum around the analogs for these implants. Now, the methods of pouring the dental implant. There are two ways to pour the impression. The first way is the conventional way that always used, like pouring any impression with gypsum product. The second method, by using a latex tube around the implant analog, and then remove the latex tube after initial setting of a stone and the space created by the tubes. Here we can see the latex tube that put over the analog to be saved, and the space saved during pouring of the impression. After initial set of the material, we can remove this latex and complete the setting of the and pouring of the material. A technique to improve the fit of a soft tissue replica on a definitive cast. It should be used when the implant is placed below the gingival level. We can use a low viscosity polyvinyl siloxane material, elastic impression material, that can inject around junction of analog and impression cupping. Here we can put the low viscosity elastic impression material injected type around the space between or the junction between the analog and the impression cupping. And then cover irregular area with wax and polyvinyl siloxane. Then we removed this polyvinyl siloxane and the wax, and removing of the thin apical edges, trimmed, and we can use as a guide on the cast so that soft tissue replica fitted on the cast. Here there will be a demonstration of a model that have some laboratory specification. We can see the abutment of this lateral incisor. We must give the laboratory screw to the technician to complete the laboratory step for construction of the restoration. Then selection of the abutment and preparation and finishing and polishing of the abutment into the laboratory. Must do a repositioning key. This repositioning key make from acrylic material, and this will be a key to repositioning of the abutment from the cast to the patient mouth to be positioned in the correct way and correct state. Make a notch to work prosthesis free and reposition it. Clinical cases. Replacement of mandibular molar. Vertical volume bone is in prosthesis axis. Bicortical cramping is possible. Then selection of the impression cupping using a closed tray technique, and then be sure that the impression post will be fitted on the implant by taking an X-ray to be sure from its seating. Impression cupping making with a classic impression tray analog attached to the impression post and seat back into the impression. So we put the analog that is suitable for this impression post and screwing it and seating on the impression place. Then using of the soft gum and pouring off the impression and opening of the impression to get the cast, and then selection of the suitable abutment. This is a titanium aesthetic abutment fitted on the cast after removing of the impression post, and then preparation of the abutment in the lab. And here we check the abutment in the patient mouth. We can take an X-ray to be sure that it is fully seated and suitable space will be there for construction of the crown. Seating of the abutment by using a torque ratchet tightened to 20 newtons. This is the ratchet that can be used, or we call it torque ratchet. And we can see the final crown construction and on the patient mouth. In summary, we can see the step starting from removal of healing abutment and selection and adaptation of the or repositioning of the impression post, taking an X-ray, and then take the impression, remove of the impression post and reposition with the analog, tighten it from the screw and reposition it on the impression. Another case for a woman 25 years, and we can see she have missing pillars. Send the patient to CPCT that will aid in selection of the size, diameter, length of the fixture. Start with the surgical part after selection of the implant and putting of the surgical screw and suturing of the implant side. Selection of impression post and then taking impression and preparation of the abutment, checking it on the patient mouth to complete the construction of crowns. Ceramic crown on inlay core screwed. We can see the crowns that are fitted in the patient mouth. After finished construction in the lab. Now we go to some modifications that can be used during taking impression, and really we have many modifications that can be used according to each case. Splint with light polymerizing acrylic resin. Here we have a space and we used open tray technique, so to be sure that these impression posts will not move during taking the impression, they used this method. Light polymerizing acrylic resin strip adapted to impression cupping, and then this acrylic resin will be polymerizing using cure. The second method that can used in impression technique is proposed for construction impression that uses a modified auto polymerizing resin custom tray to allow splinting of the impression cupping directly to the tray. Here we construct this part by using a wax around each impression post, and then we can take the impression by using a special tray. The splinted section containing the cuppings is separated from the tray with an acrylic layer, thus providing an index to verify the accuracy of the impression and the working. Now we go to the impression techniques for implant retained over dentures. The impression for entire denture bearing area can taken, and then impression implant or abutment, and after that correct the relationship between the first and second step. When taking an impression for implant retained over dentures, we can use a custom tray that fabricated with sufficient window to accommodate transmucosal abutment and transfer cupping. And after that we can take the impression and remove all these equipments in a one piece after setting of the impression material. then the definitive impression, we can see the final impression with the transfer cupping for overdenture, and the material used is zinc oxide enamel impression material. After pouring off the impression, we can see the master cast with the equipment of the overdenture. We have an alternative impression technique for implant, retained or supported overdenture. According to the system we can use for these implants, we can use the special tray or custom trays, and after do the border molding with tracing impression compound and taking the impression for the edentulous area, we can put this cupping over the implant and take it with a light cure elastic impression material. And we can see the final impression after removal from the patient mouth and adaptation of the analog over the impression post. Another case for implant retained overdenture. This is the special tray or custom tray for the edentulous area, and we have the implants in the anterior part. We must adapt the impression post that will be used for this system, and we can take the impression by using double tray technique, by taking the edentulous area with the special tray, then using zinc oxide enamel impression material, and after that selection of a stock tray that is fully seated over the special tray, and using of a light elastic impression material to take the final impression for the implant area, and removed from the patient mouth as a one piece, and then putting off the analogs over the impression post. Nowadays we have a digital impression type of scanners, and you know that the digital impression is a common method nowadays to be used for taking impression, especially for implant and crown and bridge. We have different systems and different type using special software recommended for each method. Digital impression replaces the traditional fixed level impression cupping with an implant scanning abutments. So we must have a special implant scanning abutments, and we cannot use the conventional abutment. This type of abutment that can be read by the software. The implant scanning abutment transfers the intraoral 3D position of the implant within the virtual digital cast through a registration process of the specific shape, geometry, and anatomic surface facets. We can see the shape of the abutment and adjacent and opposing teeth after taking the impression and using of specific software, taking a scan of the seated abutment on the dental cast and modeling of the customized abutment portion with specific. The benefits of the digital impression: first, improve patient acceptance, reduce distortion of impression material, pre-visualized of the preparation three-dimensionally, and potential cost and time effectiveness. Comparison between digital and conventional impression. First, digital impressions result in a more efficient. Second, digital impressions allow for additional rescans. Third, the level of difficulty was lower for the digital impression. Digital impressions, the most preferred and effective technique. 5. Conventional impression would require more experience. Impression for maxillofacial implant, a multiple tray technique for implant redented orbital prostheses and other maxillofacial prostheses can be used. A method of making an accurate transfer impression for an implant orbital prosthesis was described. A patient with orbital defect with 4 implants exposed, we can use a wax strip to do as a tray, and then using of an alginate to take the impression for the defected area. After that, an acrylic resin custom tray can be fabricated. Then upper and lower trays will be placed in the defect. Trays are perforated and only to demonstrate space created for impression cupping, and the trays can be used open in open tray system. The external positioning tray is filled with an impression material and seated over handle of all 3 tray. Impression is removed in reverse order. The advantage of this method are accuracy and removal of impressions on implants that are placed in opposing position in a limited space, which preclude removal of a one-piece. Then these parts can be reoriented after putting of the analogs and pouring of this orbital part with the implants, and these are the analogs that are adapted over the implants. Thank you.